Welcome back to the first episode of the second season of the Faith Informing Podcast. I am so excited for the next several months for what is to come on this podcast. I'm going to be hosting some brilliant and creative thinkers and writers, pastors and theologians, people who can help us think deeply about our faith in Jesus Christ and how that faith in Jesus Christ forms us as people. Today, I'm starting with Dr. Warren Kinghorn of Duke Divinity School. Dr. Kinghorn is a psychiatrist whose work centers on the role of religious communities in caring for persons with mental health problems and on ways in which Christians engage practices of modern healthcare. Jointly appointed within Duke Divinity School and the Department of Psychiatry and Behavioral Science of Duke University Medical Center, he is a co-director of the Theology, Medicine, and Culture Initiative and is a staff psychiatrist at the Durham VA Medical Center. He has written on the moral and theological dimensions of combat trauma and moral injury, on the moral and political context of psychiatric diagnosis, and on the way that St. Thomas Aquinas' image of the human as wayfarer might inform contemporary practices of ministry and mental health care. In today's conversation, I'm going to be talking to Dr. Kinghorn about his newest book entitled Wayfaring, A Christian Approach to Mental Health Care. If you or someone you know has dealt with mental illness of any kind, I encourage you to listen to this episode. I think you'll find that Warren has a compassionate and very human approach to how to care for people with mental illness. So let's dive in to another episode of the Faith Informing Podcast. Well, Warren, thanks so much for coming on the podcast today. Really appreciate you just being here and giving us a little bit of your time. I know you have a busy schedule, and even just by reading your bio, I'm like, you have multiple positions at the university, and then you're working with the VA, and I was like, I don't know, this guy is doing a lot. So thank you so much for being here.
It's kind of confusing even for me. So thanks for having me on. I really appreciate it. Yeah.
Yeah, you're just waking up each day and you're like, tell
Where
me
am
where
I
to
supposed
go.
to be? Where am I supposed to do exactly? That's exactly right. Yeah.
Well, I really appreciate you being here. Since you're probably a new person to many of our listeners, why don't we start by just tell me a little bit about your background? Like, where did you grow up? Kind of what were the influences in your upbringing, and what both led you in this trajectory towards practicing psychiatry and also connecting it deeply with the Christian faith and theology?
Yeah.
Could you
Great
tell that
question.
story a little?
Sure, of course. Well, professionally now, I'm a psychiatrist. I'm also a theological ethicist, and I've kind of had a foot in both of those worlds for the last 2 or 3 decades. But before that, I was a Southern Baptist kid from South Carolina, and I was a psychology major in college, and I found myself right out of college in medical school at Harvard, and not entirely sure what kind of physician I wanted to be, but feeling called as a Christian to the world of medicine. And I remember my first year of medical school, for the first time living in Boston. I was in the medical school is in the Longwood medical area, which is this urban concentration of amazing academic teaching hospitals and research labs that was larger than the downtown of the city where I grew up in South Carolina. It was like surrounded by all of this prestige and power and capital and wealth and investment. And I looked around and I thought, this is amazing. I'm so glad to be here. But what is all this for? Like, what are we doing here in this world of medicine and healthcare? And I realized as a medical student that I was going to be able to learn the basics of biomedical science. I was going to learn pathophysiology. I was going to learn the things you need to know as a physician. But what I wasn't going to learn was the kind of why questions, like what is health and what is mental health, and how are we to live with suffering? I mean, there were some opportunities to ask those questions, but not to have them answered in the context of medical school. And
Mm.
I began to long for more formation as a Christian in those questions. And that eventually led me through a long path to Duke. Between my third and fourth year of medical school, I took 2 years away from medical school, did a divinity degree at Duke Divinity School. And for me, that was an opportunity to like deeply engage this Christian tradition that I'd always been a part of since I was a kid, but had never really understood the depth of. Um, I was able to understand that as a physician, I was being trained in a mode of thought that is maybe 200 years old, modern biomedicine. But as a Christian, I was inhabiting this tradition that was 2,000 plus years old, and had
Mm.
a lot of things to say about what it meant to be human and what it meant to live and to die and to suffer. And I thought, this is amazing. I'm seeing myself as part of a larger story than medicine alone can provide. And that eventually actually led me to psychiatry. I initially thought I didn't want to be a psychiatrist because I was taught it in medical school initially in a way that was very rote and very cookie cutter and not very personalized and human. And it was actually studying theology that made me really just in, like interested again in the kinds of human experiences and questions that psychiatrists are invited to accompany their patients through. And so I came back to medical school after I finished my divinity degree. I decided to be a psychiatrist. I trained in psychiatry, continued to have theological questions about the work of psychiatry. Eventually ended up at Duke doing a doctoral degree in theology. And then since I finished that, I've had the chance to work as a psychiatrist in the VA system, also to teach in the medical school at Duke, and also to teach in the divinity school at Duke, where I have a joint appointment. And I co-direct an initiative here called the Theology, Medicine, and Culture Initiative. And we exist to connect the world of healthcare and Christian faith. And we actually offer opportunities for clinicians and students to come to study with us at Duke in a cohort of other healthcare practitioners and clinicians and leaders and others if they want to engage their faith with their practice more deeply. And that has been such an incredible joy for the last
Mm.
10 years or so to be a part of that. And the interest in mental health and theology has continued along the way. And I've continued to ask, like, what does it mean to be a Christian in the world of mental health care? And how can I see the beauty of mental health care, but also maybe recognize some of the ways that mental health care can be like distorted? And that's what I try to write about in this book.
Oh, that's lovely. When just going back to when you made that decision in med school to step away and go to divinity school, um, can you say a little bit more about that? Because I imagine that was not an easy decision to make.
Yeah, it was, well, yes and no. It was common in at Harvard, at least at the time, and I think it's increasingly common in medical schools, as
Mm.
opposed to this is less common in nursing and PT and OT and PA school, but it was common in medical schools for people to take a year between their third and fourth year to do research, to do a Master of Public Health, to do maybe an MBA. So the idea of taking time away from medical school was something that in some ways was accepted and even welcomed.
Oh,
The
interesting.
idea of
Okay.
the idea of taking away to study in a seminary, to study theology, was definitely off-brand and felt a little risky to me at the time. But when I approached the medical school about it, they're like, "Oh, cool! If this is your interest, then we'd love you to be able to do this." And they made it possible for me. And I remember I was still pretty worried about taking that amount of time away to do something that didn't feel like it was going to kind of push me ahead professionally.
Mhm.
At that time in my life, I was always thinking about like, what am I supposed to be doing with my education? And I remember feeling a little bit self-conscious about it. I remember going to a wedding of a roommate who was getting married, and I remember this roommate's fiance, his wife's father, was somebody who I knew kind of from a distance by reputation, and I thought of him as somebody who was, about the age of my own parents, somebody I respected. And I remember speaking with him, and I told him I was about to go to Duke to do a divinity degree and take time out of medical school, and I was like, I hope I'm making the right decision. It's 2 years, and he just looked at me and he said, "I'm so glad you're doing that. That sounds like a
Mm.
great decision for you. What a great thing to do." And it was that permission that I from somebody who was older, who I respected, that was really, really validating for me. It kind of freed me up to think, this is a great thing. I'm so glad to be able to do this. And
Mhm.
I try to give that permission as best I can to folks are thinking about doing the same thing these days.
Yeah, I love that. Yeah, sometimes that's all we need. We need someone to affirm this risk in our lives. Like we perceive it as a risk, but I'm sure someone, someone who's much older is like 2 years. That's not in the grand scheme of things.
Yeah,
It's no big deal. This is a great
yeah,
thing to do. Yeah.
yeah. And people take gap years nowadays all the time in healthcare, and it
Mhm.
actually wasn't that much of a risk, but it felt like it was to me at the time. So
Of
yeah,
course, of
yeah.
course. Yeah. So as you, went on this trajectory into theology and then back into medicine and found your spot in psychiatry, um, were there certain people you were looking up to, kind of bringing these worlds together? Because, for me, as an onlooker in the last several years since I went to seminary, I've, heard a lot from Duke and schools like Western Seminary in Michigan that they are, putting these pieces together of medicine and theology. Back then, were there many people doing that, or was that kind of a new thing?
Yeah, well, yes and no. I think the conversations have continued to grow. I think with respect to mental health, I grew up in a evangelical Southern Baptist context, but I was aware of the work of kind of celebrity Christian psychologists, James
Mm,
Dobson, obviously, but also Larry Crabb and Gary Collins and people like that. A lot of folks, you're in the Christian Reformed world, a lot of folks who had their roots in Dutch Reformed integrationism between psychology and Christian faith, and I later
mhm,
learned more about that history. So I kind of had a sense that Christians could be engaged in the world of psychology and mental health. There were also plenty of Christians at that time who were engaged in questions of medical ethics, beginning of life, questions about sanctity of life and abortion, end of life around physician-assisted suicide and euthanasia. So as a medical student, when I thought, well, what does it mean to integrate my faith into my practice? I thought that meant like I needed to learn more about medical ethics, or we might now say bioethics. And I think that's still important, but I subsequently came to realize that it's less about like having an opinion on particular ethical controversies as more as it's about what does it mean to be formed to be able to see the world of medicine through the lens of Christian faith, which involves those ethical questions like abortion and assisted suicide and aided dying and euthanasia and justice and healthcare and other things, but it also has to do with what does it mean to see a human being in front of me as created in the image of God, even when it's not a point of ethical controversy? Or what does it mean to sit with somebody who's suffering and be able to sit in the presence of their suffering and not to run away? Like
mhm,
those are theological questions as well, and I think I didn't really understand that at the beginning. I do remember in medical school going to the Harvard Medical Library and finding this book that was again in the Christian Reform world, published by Erdman's, edited by my former teacher Alan Verhey, who taught at Hope College for a lot of years, and was then at Duke, called On Moral Medicine. And
mm,
this was a compilation of work in Christian faith and practice as it related to the world of medicine, and had like older texts and newer texts. And I just remember looking at this huge book and thinking, I didn't know that this world existed. But there's
mhm,
all these people that I can now learn from and draw from. And this was before I went to seminary, but as I was getting interested in these questions. And that book and some of the meeting some of the people who were connected to that book and to the broader conversations began to get me interested in this world. And now there's actually it's a pretty flourishing world of people,
yeah,
Christians and people of other faith, but Christians who are like asking questions about medicine and healthcare and certainly ethics, but also broader questions like through the lens of Christian faith, engaging Christian tradition.
mhm,
I go each year to a conference called the Conference on Medicine and Religion that involves people from all over the country that bring together these questions. Here at Duke, we sponsor a conference each fall called Practice and Presence, where we try to ask these questions. And so one of the joys of my work here at Duke is trying to just invite people in, like Christians in healthcare, especially, to invite people into a set of relationships and conversations that if they're feeling isolated, they might not even know exist. They might think they're doing something on their own, and to
mhm.
be able to say, no, there's a whole world of relationships that you can be connected to, and I think we need to continue to do that. I need to do that, but also I think we need to do that as Christians in the United States.
So when you were writing this book called Wayfaring, a Christian approach to mental health care, um, what you pull on Thomas Aquinas throughout the entire book as like your key conversation partner.
Yeah.
And so what drew you to Aquinas's work, and how did you start to see a connection between what he was doing and like modern mental health care?
Yeah, great question. I mean, one question is why Aquinas? So I grew up Southern
Yeah.
Baptist. I'm now Presbyterian. I'm not Catholic, and many people associate Aquinas with being a Catholic
Hmm.
thinker because the modern Catholic tradition draws on him so heavily, and that's true. But one thing to say about Thomas Aquinas is he lived from 1225 to about 1274, so the 13th century. He taught in Italy and France, mostly at the University of Paris. He was a theologian of the undivided Western Church, so he wrote before the Reformation, and so Protestants as well as Catholics can see Thomas Aquinas as somebody in our own, like, intellectual, theological heritage that gets passed on to us. And so, although Aquinas is claimed by Catholics and rightfully so, I think Protestants also can read Aquinas fruitfully and be challenged by him and learn from him. One of the things that drew me to Aquinas, and I mean, partly I was just exposed to him in my theological study at Duke, especially through a Catholic theologian, Reinhard Hutter, who was this amazing mentor and guide into reading Aquinas, but also my teacher, Stanley Hauerwas. So partly I was just invited to read him, but also I found in Aquinas someone who lived and wrote at a time in European history where he was deeply formed in medieval Christian theology that was largely kind of descended from the thought of St. Augustine, who, of course, Protestants draw on centrally for our own tradition, but also in the texts of the Greek philosopher Aristotle had some of them had been lost or relatively forgotten, and they were making their way from the Islamic world of the East and from the Greek-speaking world of the East back into the Latin West, where Aquinas was writing. So you begin to see a rediscovery of the works of Aristotle. And the technical parts of that aren't so important as much as that what Aristotle represented was in some ways a kind of challenging uh, invitation for philosophers and what we would then call, eventually call scientists to pay attention to the details of the observed, lived natural world around us. Like there's a way of attending to the particularities of plants and animals and of ourselves and our experiences, a kind of goodness of observation of the world. And Aquinas embraced that in many ways, and he did embrace that it's good to pay close attention to the natural world, including the world of the human being. And so he wrote in a way that was incredibly attentive and detailed about human psychology. I mean, all of it: sensation, perception, intellect, will, emotion. And he wrote in these detailed ways, in a way that tended closely to the particularities of the natural world and brought it up into this vision of the human being as a creature of God who is sent forth from God and called and summoned by God for union with God. And so Aquinas represents this vision of like embodied human creatures who are these biological and souled beings who are finding our way in the world, drawn up in this drama of salvation. And that for me was this incredibly compelling Christian vision. And I thought Aquinas is often thought of as a scholastic medieval thinker, but the vision that he casts is profoundly relevant for how we live as Christians today, and also it's just relevant for the world of healthcare because it helps us to see beyond the idea of the human being as a kind of machine, and rather the image of the human being as a pilgrim or a wayfarer who's drawn into the life of God.
I love that. It reminds me. So I just want to read a short quote from you in your book where I think you kind of capture exactly what you're talking about. It's on page 218 in chapter 8, and you write, "For Aquinas, humans are God's good, beloved creatures, embodied manifestations of God's love, formed in a way that we are able to know God and the things of God, and to conform our lives to God's ratio, God's good ordering of the world." As creatures formed for God, we seek beatitudo in all of our actions, and perfect beatitudo is found only in pursuing God as our highest end. We are wayfarers on a journey from God to God, a journey made possible not only by our activity, but by God's gracious action towards us in the person and work of Christ. We are on the way. Christ is the way, and all our lives are those of wayfarers on a journey. And I just love that those lines, and the way that it paints such a beautiful picture of what it means to be human and what it means to live a life under God's care. So I really appreciate this connection with Thomas, because throughout my theological training, I spent some time in Aquinas, but not much. And I think it's because of what you said about kind of like Aquinas is the Catholic's theologian. Um, and and yet this book is just like, not only does are you speaking a lot about modern medicine, but like it's a deep dive on Aquinas's thinking, and I found it super accessible for someone who hasn't read a lot of Aquinas. So I really, really appreciate that.
Yeah, I mean, thank you. Those are my words, but they're not my ideas. They're Aquinas's ideas, and I like to think they're from Scripture. I think of that paragraph that you read, that idea that humans are uh, embodied manifestations of God's creative love. I actually took that directly from the work of my Duke colleague here, Duke Norman Wiersbe, who writes
Hmm.
about creation. And Norman is not a Thomist. He's not somebody who's reading Aquinas, but he is like deeply attentive to agrarian thought and to like, the Christian doctrine of creation. His point when he writes about this idea is that like we often think that human dignity comes because like we're just these biological creatures, and then God somehow like you know somehow like names us good, like God like directs God's love for us, and it's by virtue of God's love for us that we're beloved. And he says creation isn't like that, that God speaks the world into existence, that creatures don't like ever exist apart from God's creative love. And so
Hmm.
rather than thinking like, oh, we have this meaningless creation that God has somehow like imparted meaning on, it's that from the very act of creation, you can't ever get behind creation in a way that God's creative love is not there. And so creatures, including human beings, are like visible, embodied, tangible manifestations of God's creative love. And that's not exactly how Aquinas phrased it, but I think it's so consistent with Aquinas's
Hmm.
vision. And I just think it's really helped me in my clinical care and also just in my thinking about myself to see our world in that way.
Yeah, it reminds me of what I've often heard people speak of the Trinity and creation. It's a sense of like, out of God's love for himself as Father, Son, and Holy Spirit, it kind of overflowed into creation. Like that love was
Yeah,
just so much that it had to lead to creation.
yeah,
Um, and I love that way of thinking about it, because it's, yeah, from the very in creation's essence, in the essence of humanity, we come from a place of just generous love. And I
yeah.
mean, there's nothing better in life than that. In any relationship, you want to know people who are generous in their love for you.
Yeah, that's right.
Yeah.
And that vision is obviously central to Reformed theology. It's also central to I think Western theology as a whole. And Aquinas very directly drew from that and is thinking on beatitude or happiness or flourishing. It's hard to translate in a consistent way, but Aquinas held as with Augustine and with I think the Western Christian tradition that like God in God's self is eternally happy in the sense that
Mm,
in God's self is all the fulfillment of perfection, and so what God offers us in God's creative love and goodness is a kind of impartation of God's own goodness and happiness and flourishing. And so when we talk about our own flourishing or our own happiness or our own beatitude, that's where beatitudo would be the Aquinas's term for like for the flourishing of creatures, then it's in some ways always a kind of approximation or anticipation and participation in God's beatitude. And So when I translate that term beatitude or beatitudo, the Latin term in the book, I don't translate it happiness because it's not just an emotional state. I don't even translate it flourishing because that would imply that like flourishing can happen apart from God.
Mm,
But I translate it as participation and blessing. Like it's God's blessedness that in some ways is kind of open to us. And insofar as we find life and we find happiness and flourishing in this life, we're doing so by in some ways anticipating, participating in God's blessedness. So I love what you just said because it
mm.
starts with the Trinity's perfect indwelling love, in and of God's self, and that then spills over into the rest of creation. And how when we're like out walking, in the morning, or as I'm sitting in a office right now and interacting with people over the course of the day, how do I see like all of creation is in some ways a kind of overflow of
Mhm.
God's love. And that includes when I step into a clinic and into a hospital. How do I see every human being as an overflow of God's creative love?
Yeah, it makes me it's a vision of life that says which I think it's hard for, the modern person, myself included, to let that vision kind of wash over me because
Hmm.
in some sense we're so used to living life like um we don't think about participation in something other than ourselves. So
Yeah.
like if we want to participate in a baseball game, we
Hmm.
we buy tickets, we make the choice to go to the game, we show up at the game, we're there for the game, and then it's over and we go home.
Hmm.
And this idea of participation in God is like having an imagination that wakes up and is like, I'm already in God's presence. Like I'm
Hmm.
already living like everything a part of me, everything I do today is in God. It's not apart from him.
Yeah.
Um, and I think that's just such a powerful vision that is so needed in our world today, where we're kind of, I think of like the loneliness crisis we have, um,
Yeah.
kind of this sense of like we're all on our own, and it's up to us to build our lives and make a living and create something of ourselves. And yet, the beginning of each day, it's always this grace that's like, well, actually, you're not on your own, and God is right here with you, and you're in God's presence, and you're participating in all the things that He loves. And I love the way you talk about not just the blessing of like the beatitudes, but you also talk about I can't remember how you put it, but kind of the opposite of that, of like um, the things that are like you use the word revulsion, like we oppose because they are opposed to the things that we actually love, and so
Yeah.
it's like you really do a great job of comparing and contrasting those two, where you're navigating life between we're drawn to what we love and we're not drawn to the things that are against our loves. And some
Yeah.
you make the point that sometimes we can have our loves in the wrong place and we can be loving the wrong
Yeah.
things, which I think
Right.
is really important. But
Yeah.
yeah, what a vision of human life. It's beautiful.
Yeah. I mean, two parts to that. To the first part about participation, I mean, yes, I mean the lie that our culture tells us and that we tell each other, or one of the lies that we tell each other, is that we're alone. And in our modern culture, like our social value and worth all too often comes from our identity as producers and consumers, and especially as individual producers and consumers. And
Mm,
in a kind of, you know, modern modern capitalist world, like we're constantly being asked to like develop and market ourselves to be our own entrepreneurs and firms, as the pastoral theologian Bruce Rogers Vaughan says, always marketing ourselves as like individual firms so that we can be, you
mhm,
know invested in and not disappear. And that leads to exhaustion, it leads to loneliness, it leads to anxiety. I think a lot of the mental health crisis in our culture, which is largely a crisis of depression and anxiety and substance use, is driven by this sense that like we're alone and we're on our own to make it as producers and consumers. And
mm,
that is fundamentally a lie from the
mm,
perspective of Christian faith, because we're not alone. I mean, we are created by a good God who loves us and who knows us, from the moment of conception and throughout our entire lives, and that never stops. But also, like, central to the gospel is that, like, our lives are bound up in the life of Jesus. So if you look at Galatians 5 or Romans 8, that the Holy Spirit, you know, in through the person and work of Christ, the Holy Spirit draws us into the life of Jesus, so that we can then be in the presence of the Father and be able to say to the Father, Abba, as Jesus does, and to then stand in the loving gaze of the Father for the Son. And we're bound up in Jesus' life. And we are collectively and together the body of Christ. And so we're not alone. We're participating in the life of Christ, and therefore participating in each other's lives. So we're called to be, like, fundamentally participatory, interdependent, and to belong to each other. And that's what we most deeply need as human beings, because it's what we're created for.
Mm.
And our culture just so often leads us to believe that that's not the case. And I think that's something we just have to stand against.
Yeah. Yeah. So, um, I possibly should have started with this question, but when you were thinking about this book, or like as you thought up the idea of the book, um, we're starting to get into now like the needs in mental health, like
Mhm.
anxiety, depression, like the real people's lives are in
Mhm.
turmoil.
Yeah.
And so what prompted you to write this? I know you get into the machine metaphor in the beginning. Was that the prompt that you were feeling like really needed to be addressed, or like what you drew you into this specific book?
Yeah. I think in terms of how the book, it came together over a period of years, and it largely reflects my own kind of struggling and thinking through, what does it mean for me to be a psychiatrist and to practice
Mm,
psychiatry that I can feel good about as a Christian, and to actually learn to see the beauty in. And so partly it's my own kind of searching. It's also, as we talked about earlier, I kind of found in Thomas Aquinas this incredible richness for thinking about human life and human good. And so trying to think about how can Aquinas be directly helpful in helping us to think through it. But eventually, as the book took shape, I began to realize that what I really wanted to be able to do, and what I hope comes through in the book, is to contrast two ways of approaching the human being that I think corresponds to two different approaches to mental health care. And in the beginning, I talk about what I can see some good in, and I make clear there are some goods to this, but I also want to be very cautious about is what I call the machine model, or machine metaphor of mental health care, that fundamentally sees the human being as a kind of machine that breaks, and when it breaks needs to be fixed along some kind of industrial process. And I think a lot of healthcare, frankly, functions in that way. And
mm,
we can talk more about that. And to contrast that with Aquinas' vision of the human being, not as a machine, but as a wayfarer or as a pilgrim, as someone who is from God as God's good creature, who is on the way to God as our hope and our goal and the joy of our life. And we're on the way. And so healthcare, including mental health care, and frankly, any kind of care, is I, as a wayfarer, come alongside someone else who's a wayfarer, and I ask the question, like, what kind of journey is this person on, and what's needed right now for the journey? And that image of the human as wayfarer, not as a machine to be fixed, but as a person, as a pilgrim to be attended, to me just leads to a very different way of thinking about healthcare that I
mm.
think is has been really life-giving for me. And so the book is a attempt to try to give voice to that and to think through how that can be a kind of offering to especially to Christians, but also to others who want to think through, like, how can we practice a more humanistic kind of medicine and mental health care.
Yeah, can you give an example of like what that, like a yeah, just like kind of a tangible example of what that machine metaphor would look like with you with the patient? How would you treat them if you were treating them like the
Yeah.
machine?
Well, it's probably easier to imagine in other kinds of medicine, where we,
Okay.
we tend to see the human body as a kind of machine that breaks. And so, you can think of an orthopedic surgeon as like fixing joints and bones that have,
Mhm.
are broken. And kidney specialists is fixing, problems with the kidney. It's a little harder to imagine in psychiatry because our work is already so language based and so holistic. But here's what I would describe, and I think this is the way it works in psychiatry. Like, let's say that I want to build a mental health care system that functions as a kind of an efficient industrial process, which I'm not saying all of mental health care is like this, but let's just say I wanted to do this. One strategy would be that I could train clinicians, including myself, to have people walk into my office with, we might say, like unwanted experience and behavior. Like they're feeling ways they don't want to feel, they're thinking things they don't want to think, they're acting in ways they don't want to act, they're caught in cycles they don't fully understand. And I'm trained to say, oh, I recognize what's going on with you. You have symptoms, which is already
Mm.
a way of renaming experience into something that I can manage and control. So I might hear somebody speak and I say, oh, you have a symptom of loss of energy, or a symptom of loss of pleasurable activity, or a symptom of poor sleep. And then I'm trained to like aggregate symptoms as a psychiatrist into diagnoses. And so if someone has, 5 of 9 criteria over a period of 2 weeks for the diagnosis of major depressive disorder, I could say, oh, like based on these symptoms that you have this disorder called major depression. And then I can, once a diagnosis is established, I can reach into my toolbox of evidence-based therapies and technologies, including medication, but also including referrals for therapy and other kinds of things. And I can say, well, here's what we can bring to this disorder to reduce your symptoms. And then the patient leaves my office and they come back. Let's say I prescribe a medication and they come back in 2 or 4 weeks and they say, oh, I'm feeling better. And I say, great, your symptoms are reduced and therefore the treatment is working. And so continue the medication and come back and see me in a month or whatever it is. And
Mhm.
and of course, anything that we can apply technologically, we can buy or sell, whether that's units of our time or whether that's a medication or a device or whatever. And so in that way, you can kind of keep a mental health economy running, like by focusing on mental health care as symptom reduction through the
Mm.
application of technique and technology to treat symptoms of disorders. And that's a very compelling logic. It governs almost all of like psychiatric and psychological clinical trials. Like when we even with psychotherapies, when we try to see if psychotherapies are working, what that means is that we're measuring symptoms before and after treatment, and we're seeing, does the therapy help to reduce symptoms? And I think that's compelling. We need that kind of careful observation. There's nothing wrong with wondering if our practices are making a difference in terms of how people are feeling. But I want to ask, like, what's missing there? Like, you can easily focus so much on mental health care is reducing symptoms that anything that can help reduce symptoms, like, counts as good care. And you can miss kind of broader questions, like, not like, am I feeling better, but like, what does it mean to live wisely in the world? Um, you can miss more deeply human questions, like, do I matter? Do I belong? One huge thing that I worry about is that by focusing on symptom reduction, we tend to individualize mental health problems because people come to us as individuals and that's what we can manage. And so we tend to fall into this assumption that mental health problems happen inside me or inside my brain, is something that's wrong with me that needs to be changed and fixed so that I can work on myself. Whereas a lot of the kind of mental health problems that we see all around us and feel in ourselves have to do not specifically with something that's wrong in us, but with something that's wrong in our broader world, in our relationships, in our communities, in the culture in which we live, which of course now is incredibly frayed and stressed. And I think insofar as people are feeling distracted or irritable or anxious or depressed or even dysregulated in the context of a community that's frayed and distressed, then we need to be able to name that broader reality and not to reduce everything to individual symptom reduction. So I think there's benefits to seeing mental health care as a process of symptom reduction, and there's also huge losses. And at its worst, people can go to a psychiatrist and they can leave thinking, I have a medication, but I feel like I was just treated on an assembly line. I feel like I just
Mm.
got a medication, and this doctor, this clinician doesn't really know me as a human being. Um, they just care about like, my symptoms. And we don't want that kind of care system to exist. At least,
Yeah,
at least,
yeah,
at least it's not enough. Yeah.
right, right. Yeah, because there is, and even in my little experience of going to a doctor, getting, doing the evaluation for like depressive symptoms or
Yeah.
these different about anxiety symptoms. Um, it can feel like when you're even when you're filling out the form, it's like, but this isn't all like this isn't the
Yeah.
whole of it. Like
Yeah.
yeah, I'm having some of these symptoms, but like
Yeah.
I need to share my story here.
Yeah.
Yeah,
Stories over symptoms. Yeah. Yeah. Symptoms
yeah,
matter, but stories
yeah,
matter even more. Yeah. I agree.
yeah.
Yeah.
Because then it's yeah, I just, I've seen so many times where it's yeah, they're you're someone's feeling depressed or feeling really anxious. But if you don't have time for the whole story and you find out that, oh, their spouse just lost their job or their
Mm,
kid is struggling in school and they get called every day by the principal, and you know
mm,
all sorts of life circumstances are happening that are causing or at least contributing to some of these symptoms. um,
absolutely.
and
Yeah.
those are definitely really important. Another thing I noticed, like as you were talking, was also it's kind of like if your mental health is only about you, and
Mm,
then you're like it's all about getting your symptoms reduced. It's kind of like saying like you're broken, and we can make you a little less broken, but you're kind of
yeah.
still broken, which
Yeah.
which isn't a great feeling either.
Yeah. You can have diagnosis can become a kind of identity. Like you just are a broken person that's
Hmm.
constantly needing to be tweaked and fixed. And we have to be careful about that kind of like making diagnosis into a kind of identity. Um, there's also a real question, I think, around like what is the point of our therapy? So can we get into a catch-22? So I mentioned earlier, I'm kind of affected by people like Bruce Rogers Vaughan and Therese Lysod and others who kind of talk about the connection between mental health challenges and the kind of uh, neoliberal free market orientation of our culture that's been the case for many decades. And like if we're in a culture, as I said earlier, where we're valued for being producers and consumers, and then people come to a therapist or a psychiatrist and they're like, I feel underproductive and like I'm falling behind and I need to be in therapy so that I can get back to being more productive
Mm.
and meet the kind of social expectations that are on me by virtue of living in a place like the Research Triangle in North Carolina or the Bay Area or anywhere else in the country where we're kind of feeling stretched. And then therapy is it serves the goal of like just getting us back to a status of being producers at a certain level and speed. Then we're feeding people right back into the system that actually creates the problem to begin with. And so we have to be careful to think about like when we're seeking therapy or when we're offering therapy or like what's the goal? What are we doing? Like what kind of vision of human life are we pointing at? And and that doesn't mean that therapy is not a good thing. It is, but it always matters. The why always matters. Like what are we hoping
Mm.
for? And if the hope is just to be able to get back to a place of maximum productivity, um, then we might want to just think about that. Like what are we aiming for in our lives?
So what do you think is the hope then? Um, if productivity and like, just being able to like get up the next day and go to work and have a full day.
Yeah,
If that kind of falls short in some ways, like what do you suggest as kind of like better goals, better
yeah.
hopes?
Well, it's hard to I can speak in abstractions, but the abstractions are never going to be enough for
Mhm,
specific discernment. So, I mean, most broadly, I mean, all of our lives, including the way that we engage in therapy, ought to be oriented in some way toward kind of a life lived in the love of God, pursuing um, union with God and growing in love for God. And so that, as Christians, that's a kind of that's a kind of orienting goal for our lives. Now, what does that mean for me if I'm in the middle of a academic semester and I'm feeling stretched and I'm feeling that things are fun, but like that abstraction isn't helpful. But I think um, what does it mean for us to think about like what do we most deeply long for and need as human beings created in the image of God, oriented to God? And I think that that we certainly need to be able to work. We need to be able to pursue meaningful work. We need to be able to pursue meaningful relationships.
mhm,
We need to be able to have a kind of full range of emotional responses for the complex things that are going on in our life, and it's good to pursue those kinds of goods. But I think a key question for us, and I think about the distinction between control and wonder. Like,
Mm,
are we living our lives, including engaging in healthcare or mental health care, just to keep uncontrollable things under control, to try to keep ourselves in a state of maximum control over our lives? Uh, or are we finding ourselves, like, in the context of engaging in therapy, in the context of, frankly, living a human life, are we finding ourselves becoming deeper lovers of God and of ourselves and of our bodies and of the created world around us and of um, and especially of others whom God has given us to love? Like, are we finding ourselves drawn in love in, like, deeper and more life-giving relationships
mm,
with God and with others? And I think I'd much rather have a kind of therapy oriented toward those kinds of things, like what's happening in your relationships, what's happening in your relationship with God and with others and with your family and with yourself and with your body,
mhm,
and to focus on kind of growth of depth and intimacy in healthy relationships, than only focused on, like, do I feel like I'm performing at a certain level at Duke, in a way that
mhm,
I'm expected to do in an elite university or, industry context.
mhm. Yeah, that's really helpful. I think, going back to what we were saying earlier about how we're kind of geared to be consumers, um, it it can become like a lot of different elements in life that are contributing to that. Like, we're talking about mental health care. Like, we show up at our doctors and we're like, we're not only are they like interested in fixing us, we're like,
Mhm.
fix us. We
Yeah,
like, hey, we paid the money, we're paying for
yeah,
insurance, like give us the fix.
absolutely. Yeah,
And then I also think about that in light of the church too. Like, on Sunday, so often I think we have a felt need, Christians have a felt need of like, we show up to church on Sunday expecting to be fixed in some way, expecting
mm,
to be
right.
healed, expecting to be comforted.
Yeah,
And it's not that none of that happens. I think comfort definitely comes when you gather with believers, um, but it's easy to forget that, like, oh, when we come to gather to worship, we're actually gathering to love and be loved by God, and like,
yeah,
there's something so much greater than our lives going on there. But
yeah,
it's also, something I've been thinking a lot about lately personally is like being able to sit with the pain of life. Um,
mm,
I've definitely, in my adult years, I've definitely been in this environment of like, like, I went to therapy, all my friends went to therapy. Like, it's
mhm,
very much a
mhm.
culture of like people my age. We're all like, yeah, we're all going to therapy.
Yeah, yeah,
And
yeah,
way different than a generation or two ago.
yeah. Which
And
is which is a good thing. I'm grateful for that.
yes, yeah,
Yeah,
I've
mhm,
benefited. I'm a huge proponent of therapy, and I've
yeah,
benefited greatly from it.
yeah,
Um, but the downside, at least for me, has been like, it can become like an obsession with fixing myself. Like, I
yeah,
need to have it all worked out. I can't, whenever suffering or pain or these feelings come in, I've got tools about how to breathe better, about what I do with my body, and I got to implement
yeah,
those and make this feel better. And
yeah,
one thing I've been practicing a little bit more lately is like, well, how do I, as a pastor, I've been trained to sit with people who are suffering. And I'm like,
mm,
how do I learn how to sit with myself in suffering? you
yeah,
know, how do I
yes,
learn um,
yeah,
to experience this? And it reminds me of the story of Jesus's crucifixion,
mhm,
where in Jesus's most shameful, painful moment, uh, most of his disciples fled, and
yeah,
obviously they were afraid for their own lives. But
yeah,
it just strikes me as kind of like an image of like the suffering Christ. Man, we just want to get away from that.
Yes.
Um,
Yes.
and when we see the suffering Christ in ourselves, it's like, oh, I got to get away from this.
Yeah.
And yet God promises us resurrection through suffering. And so it's so, you know,
Yeah.
again, the gospel just saying something that seems so outlandish in many ways.
Yeah.
But I think there's a sense as Christians, uh, we have to practice sitting with it.
Yeah. I just resonate with everything you said. I think that's right. And that's where, although I'm Presbyterian, where we typically have empty crosses in our church,
Hmm.
I think there's a lot of um, value in like meditating specifically on the suffering of Christ, as our Catholic brothers and sisters do, in an
Hmm.
embodied way, and understanding that the point of Christian faith is not to kind of prevent us from all forms of suffering, although we would hope for that and anticipate that in the resurrection, but
Hmm.
rather that 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 God has united God's self to all of our lives, including to our suffering in the person of Jesus, and carried our suffering into the very life of God so that we're not alone. And that in crucifixion joined himself to our suffering, and in resurrection and ascension points the way to a future without suffering that is already and yet not yet. And so it's that living in that place of not being alone, of hoping for God's good future, uh, and anticipating it, but also not pushing it, but not denying the reality of suffering now. That just seems to me such a perennial challenge for us, but it's our invitation.
Yeah. Well, I think that's a wonderful place to to finish up our conversation today. Warren, thanks so much for being on the podcast.
Thanks, Travis, for hosting me, and really grateful for your work. Thank you.
Yeah, really appreciate you. Well, thanks for listening to another episode of the Faith Informing Podcast. As you go today, I wonder what kind of journey you are on right now. What kind of challenges and hurdles you're facing in life that you need people to sit with you and feel the pain with. People that can help you navigate some of what life is throwing at you right now. And I wonder if Warren's words that we aren't just a group of symptoms needing to feel better, but we are beloved by God, that we come from God and we're on our way back to God. How do those words encourage you today? My prayer for you is that you would know deep in your soul, that you would feel it in your bones, that you are God's beloved, that nothing can change that foundation cannot be shaken, that you belong to God. Until next time, take good care.